Tell me, what's one of the challenges, what's one of the things that you guys see heading into a project that maybe the dentist doesn't account for, and maybe it's a surprise whenever he or she actually gets into the project?
It's a good question.
Well, and Kevin, what we see a lot is it's very difficult for dentists considering a new project, remodeling, any kind of endeavor, to get good data on timelines, potential project costs, people that would be involved, your service providers. So it's hard to make informed decisions when you don't have, you don't have good data in hand. So you will find people that, not from a malicious standpoint, but for example, you go out in the marketplace and you say, okay, I'm doing a new dental office of 3,000 square feet. You talk to a contractor, for example. Well, that contractor would love to get that project. So, okay, gee, Mr. Contractor, what does it cost to build a new dental office? Well, gosh, we did one 3 years ago. It turned out great. Dr. Smith down the road, he loves us. It was $130 a square foot. Well, that may be what Dr. Smith spent 3 years ago, or it may be sort of a massaging of those numbers because that contractor wants the job.
Sure.
Then you go talk to some design people, for example. Well, gee, what would it be for a 3,000 square foot office? Well, gosh, it depends on this and that. It may be 10%. Okay, it's 50 grand or something. So you start accumulating data that's not necessarily accurate and doesn't necessarily reflect that moment in time in the design and the construction industry. So you're making decisions on sort of some of these lowball offers in an effort to secure work, and then you get down and through the process to a certain point and realize, oh my gosh, it's 30% more, it's 40% more, and then you lose trust. You lose trust in people around, and it can be a very stressful situation. So we see people struggle through the logistics. I mean, in our world, the design part is fun. It could be anything you want. It's budget driven. But the logistics of getting a project going with good data where you can make informed decisions on the size and scope of the project, what I'm going to invest, what makes sense in my practice, those are the challenges in our view.
I think to add to what you're saying too, Kevin, I'm seeing that they have a tendency to look at the project cost as just the cost of construction. And there's so many other associated costs with the project. And when you're making informed decisions, it is about looking at all the potential costs that you can look at, and who is it that can do that for you, or who is it that can look at the bigger picture. So there's equipment, there's technology, there's furniture, there's artwork, or do you want furniture and artwork?
Sure.
There's inventorying existing that you might have and bring over, and then what would be left over, what would be a realistic number for that. And then soft costs, the investments you make in an attorney, in an accountant, in soil testing of the soil if you're doing a new full building, that kind of thing. So looking at the entire picture, it's just really advisable to get all the costs assembled to make that best decision before you jump in and assume that you've got everything you need.
Well, costs and logistics. I mean, costs are one thing, but obviously, if a project, we have a lot of people will come to us and go, gosh, I'm losing my lease, or I'm in a bad partnership or an associateship. I need to get out. I need to be in 2 months. I need to do a new lease space, and I need to be in 2 months. Okay, that's not, that's typically not a feasible thing to do. If you have any kind of design vision other than throwing stuff in a room, for example. So that has cost implications, but the people are unaware of really what are realistic timelines in today's design and construction market, which can have major cost implications. If you're being thrown out of your space in 2 months and you really want to do a new space, but it's not going to be ready for 9 months, there's some real challenges there, and there's ways around that, but that can sure stress anybody out and create many issues on
I think what we're talking about, Kevin, is really just the pre-design or due diligence. Those are the words we use. And dentists are real willing. Our experiences as dentists are real willing to do that. They want to do that, but they don't know what all the sources are to them, or resources are available to them that will allow them to discover, what the implications of this particular project might be for them.
What are those resources?
Well, it's something that we do, and we do that as a service not only to our clients, but also to ourselves, quite honestly. We want to know that if they're considering a build out of a lease space or this building on that property, that in fact it's going to be a viable candidate to do what they're asking this building or this lease space to do. And it really serves us it really serves our clients, and it serves them best if we can examine the logistics of all of the things that they're gonna have to consider going into a project. So if we were to list them, it would be the site that they're considering, and a site might be a piece of property or the lease space they're considering. And is it going to do everything that they want it to do? And that's a matter of just programming and talking about, what do you want in this lease space? What do you want in this building? The location of any of these, is that going to be the best location for your practice? The costs associated with this, and the level of service that you want provided to this. And we probably more than most will talk through all the options as far as service that can be rendered by someone like ourselves, by engineers, by the other professionals that you might be engaging to support the design, construction, and pricing of this project.
And one thing we really love about dental economics is that there's a real commitment to understanding dentistry, from a clinical, functional standpoint, but the business side of dentistry. And you've had many great articles that address things like planning. You'll have investment advisors, lease negotiators, accountants. That's all part of that team to get good data, so you can make upfront informed decisions on what's the best project, for your practice. And you guys have done a great job with that. I mean, you're the by
That's why
far
we're
the
here.
leader,
That's why we're
the
here.
leader in addressing business aspects of dentistry in an appropriate way that also promotes dentistry and all the good things that dentistry does for people.
So as long as dentists dot the i's and cross the t's.
Sure.
Sure. And it's like, well,
it's
we
like
all
anything,
heard,
sure.
good planning is, the better the planning, the better the outcome. And so, and dentists are really good at that. They really typically want to have all their ducks in a row, as they say. I know that's a cliche, but they want to have all the information there in front of them. And what better way than to go into a project knowing that you've calculated a viable outcome and can be confident that as it goes along. The better they do that on the front end, the better they're going to be not off base on the back end. There's nothing more discouraging than getting into construction. A lot of dentists do this. They get into construction and discover that the anticipated prices or costs of the project are very different than what's actually happening. That's also why you see lenders putting 20% margins of contingencies on these projects, because doctors have done little planning. They may have few documents. They may be working with limited service to the project, and as a result, the cost overruns are typically going to be 20% on those projects. And we like to see them more like 1 to 2%. We think that's a better service to the doctor.